Hi, I'm Jolene Miller, and I'm joined by Tri-Valley Health System Dr. Rachelle Kaspar-Cope. Thank you, Dr. Kaspar-Cope, for joining us.
Thank you for having me.
Yes. So today we're going to be talking about menopause, and I know this is a subject that a lot of people have a lot of questions on, and there's a lot of confusing information out there. So I just want to have you kind of talk about that, and I understand you have some certification that you've received in that, so tell us about that.
This past year and a half, I prepared to take a test for the North American Menopause Society. I took it at the end of November, and I passed. I kind of started preparing about a year in advance for that, taking some different online classes and attending virtually in the times that we've been in 3 of their annual meetings, educating me more about menopausal care. And I had done a lot of this before, just with my patients, but I didn't feel particularly equipped to answer some of the questions and to better address things. I'm 55 years of age, so I'm kind of right in the throes of this as well, and selfishly wanted to have a better understanding about how to navigate this a little more comfortably for myself. As I was younger, I've been in practice here for 25 and a half years. So when I first came, I was having babies and breastfeeding and all those things, and that was what I was most interested in. And I think we age with our practice, and so I was getting more questions about menopause and feeling less able to answer them as well as I would have cared. So I just went and did a little extra study, most of it, online through COVID and such like that. And the North American Menopause Society is really kind of the gold standard in menopause care as far as all evidence-based medicine following, really standard and recommended treatments for, the symptoms that women experience during menopause.
Okay, and I think that's great because there's so many remedies and things that people recommend out there to treat your menopause, and I think there's a lot of confusion out there on that. You hear about the pellets. You just one of them that you hear. So can you tell us why sometimes menopause is such a confusing thing to go through?
Well, it is a natural, a life change, but it's wrought with a lot of complicated symptoms. Women's health issues have always been kind of downplayed, and we don't talk about them. And now we're of course much more open about talking about having babies and breastfeeding. And menopause is just kind of that next stage that I think as a society we're a little more open to talking about these things. We obviously have a lot of information at our fingertips through the internet, and women just don't really have to suffer in silence anymore. We have a lot of good therapies for the various challenges and symptoms that women will experience. It's not a disease, it's something we're meant to go through, and it can be very challenging and difficult for some women, and it can be a breeze for a smaller subset of women. So I think just knowledge is power, just knowing more and having more answers. And we as the medical profession, I learned darn little about menopausal care in medical school. We learned about the stage and some basic things, but it's not until you get in the throes of it with talking to patients each and every day, different women about different challenges, that you really understand that there's a lot of suffering that goes on with this lifestyle change, or life change, I should say, also.
Right. And so you mentioning just some of the different stages of menopause. Can you just quickly go through some of those, like the perimenopause, the menopause,
Sure.
What sometimes you see during those?
Perimenopause is something that can last anywhere from like 5 to maybe even as long as 10 years. Oftentimes begins in the mid-40s. It's kind of that 5 to 10 year lead up where hormone levels, maybe women are not ovulating quite as regularly, or those hormone levels are not peaking out as much. And so you can start having symptoms. The common ones during that can be night sweats, irritability, weight gain, menstrual irregularity, those kind of heavier periods, more irregular type periods. And then menopause is when our period, we say we've gone through menopause, or we are officially post-menopause when we've been without a period for a full year. And sometimes you'll go 11 and a half months and boom, have a period. Well, guess what? You're not, it's like the clock starts over.
Okay.
And so menopause is defined, it's not an event, it's a change, but you go from perimenopause, kind of the symptoms leading up to it, to when you have cessation of your periods, And for women who've had hysterectomies, they don't have that, so we have to gauge that from some other symptoms. And then when you've been 1 year without a period, or that we can document that you're not still actively, sorry, I'm not using the best words here, actively going through ovulatory cycles any longer. When you've not done that for a full year, that's when you are truly postmenopausal.
Okay, perfect. And then can you just kind of go through some of the treatments that you really recommend, that if somebody came to see you, that these are some of the things that you would say, and maybe put somebody on medicine or other treatment options?
It's really a very individualized approach, that there's no one size fits all, because everybody's symptom complement is quite different, and we really try to target your most bothersome symptoms. A lot of these things will just be lifestyle changes. Not everything requires a pill or a medicine, and you're not broken, you're transitioning to a different stage, and so sometimes we need some support to target the symptoms. So I use kind of FDA approved, generally evidence-based supported hormone therapies, and that can be in the form of pills of estrogen or progesterone. It can be a patch. There can be some vaginal creams and some vaginal inserts. Those are some of the other vehicles of delivering hormones. Not every woman is a candidate for hormones, depending on where she's at and some of her familial risk factors or personal risk factors. There are lots of other medications that can target symptoms, and there are lots of other lifestyle things that can target symptoms beyond just hormones. The North American Menopause Society, and generally evidence-based medicine in general, and by that I mean medical practices that have been studied and put through rigorous studies documenting the safety and are approved by the FDA or the Food and Drug Administration. Those are the things that I'm using.
Yeah. Okay, perfect. So what would you recommend the next steps a person could take? What, just come see you and set up an appointment for a consultation?
I think if you haven't been in for an annual physical with your own primary care physician, I think that's important. Go have that done. Go to the person who knows you best. And menopause generally is happening 45 to 55, average age being 51.3 in the United States. Know that you're good, and know what your health is like in terms of blood pressure, maybe blood sugar, maybe lipids. It's really nice if you have those labs, because that helps tell me a little bit more about your cardiovascular risk factors. So if you have the opportunity to do one of our health fairs in the summer looking at blood sugar, lipids and such, if you come with that, that just makes decision making a whole lot better. It also helps to bring your family history, kind of ask some questions. If your mother's still living, ask her roughly when she went through menopause and what her experience is like. Yours is not going to be just like hers, but timing wise it might give us some pointers. Older sisters are another good resource, that if you have an older sister, ask her what her experience is. And if you don't have those relatives, that's just fine. We're going to target your symptoms, but it's nice to know what others have been through, whether or not there is a breast cancer risk or a cardiovascular risk or history of diabetes, heart disease, high blood pressure, or stroke in your family. Those might gauge our or direct our therapies a little bit in terms of those risk factors. And coming prepared with that, if you haven't seen anybody, I certainly am a primary care provider. I'd be happy to do your annual physical. If you haven't had a relationship with a primary care provider in some time, you could set that up as your annual physical. Probably do that. We touch on the issues, and we'd probably have you come back for a follow-up appointment then to now let's address the problems a little more fully once we have kind of an assessment of your baseline health.
Yeah, okay. Well, thank you so much for joining us and helping to shed some light on this menopause that is a very common life journey. So if you have any other questions or you would like to make an appointment with Dr. Kaspar-Cope or any other providers, you can call our clinic at 308-697-3317. Thank you again.
Thank you, Jolie.